Surgery in Early 20th Century Appalachia
by Amanda Pearson
and Charlotte Castellano.
In the past 200 years, surgical practices have advanced drastically in procedure and effectiveness. In 1799, Humphrey Davy, a chemist and surgeon apprentice, discovered that ether could be used as a pain-relieving inhalant. At the turn of the 19th century, anesthetics became a regular practice in surgery. Anesthetics that emerged following Davy's discovery include chloroform, cocaine, and novocaine. Beyond alleviating the intensity of surgical pain through anesthetics, surgery advanced in complexity following the discovery of antiseptic surgery. Surgeries such as ectopic pregnancy removal, which was a previously inoperable condition, could be performed without complication. By the end of the 1800s, the discovery of X-rays enhanced surgical practices immensely for the upcoming century.
The invention of X-ray machines allowed surgeons to successfully replace bones such as hips and knees. Intensified research advanced brain and heart surgery and eventually led to the invention of pacemakers and successful heart transplants. These successes made a global impact, but many geographical areas did not have access to technology and knowledge. Appalachia lagged behind. The oldest direct documentation of surgical practices in the 20th century Appalachia showed that the surgeons were making advances, but they were few in numbers and still practiced under primitive conditions.
Appalachian surgeons were under great pressure to assist the ill. Across the region, surgeons were sparsely dispersed. For example, in all of Avery County as late as 1949, there were only 6 physicians, 1 dentist, and 7 midwives available to assist the community and administer necessary procedures. Many patients had to travel long distances. Dr. Mary Sloop recorded that one woman journeyed 100 miles from home for exploratory surgery for the mass in her stomach because her local surgeon was neither knowledgeable nor experienced enough to perform the surgery himself. Commonly in Appalachia, pseudo-doctors were called because of the lack of certified physicians. Many medical protocols were adjusted or abandoned because of the conditions. Many surgeries were performed outdoors based on the belief that fresh air decreased susceptibility to infection. When performed inside a home, surgery entailed much higher risks due to the unhygienic environment of the home, although some surgeons believed a patient's home was actually safer because of immunity to one's own germs. During winter months, surgery had to be conducted in the homes of the patients because the inhospitable weather would not allow for outdoor procedures.
Preparation for upcoming surgeries required many steps to create the most efficient environment for the procedures, including sterilization of the area and gathering of instruments. The patient's families had to find a clear, open space for the procedure, often a dining table, and had to sterilize the area to the best of their abilities. During a serious surgery performed by the Dr. Sloop during one of Appalachia's harsh winters, they told the patient's family to clear and scrub the kitchen table. The isolation of surgeons from their patients in Appalachia often meant that essential sterilizing equipment was not accessible. Surgeons were prompted to innovate sterilizing equipment from the rustic implements available. The Sloops had their own improvised sterilizing equipment made from a 50-pound lard can and a tin pan purchased from the local store in Plumtree, North Carolina. If they had to travel to patients' homes, the Sloops requested that families have a clean washpot full of boiling water prepared before they arrived. Similarly, the supplies for more delicate surgeries, for example procedures on the face, were not always obtainable either. Dr. Sloop used a horsehair to stitch a gash on a young boy's forehead because all his other sutures would leave an ugly scar. When it was feasible, typical equipment methods were implemented during surgery in Appalachia, such as gowns, masks, and dressings. However, with the prevalence of pseudodoctors and unqualified physicians in Appalachia, many of those treated by them suffered from unsanitary conditions.
Complications were common in Appalachian surgeries during the early 20th century. Many physicians lacked up-to-date medical knowledge, instruments were not properly sterilized, and equipment was not suitable for the procedure at hand, leading to many fatalities. For example, one woman was unable to birth her baby. The midwife was unsuccessful, and the 2 pseudo-doctors called were also unable to assist the birthing process. When a medical professional was finally called, it was too late. The woman and baby both died before help could arrive. The number of newborn and infant fatalities in 1948 in Avery County was 62, which is roughly 15% of the births in the area. In some instances, the The surgeon's practices were not the issue, but rather the problem was concerned family members bringing germs into the operating room. Family members crowded around the operating table, and the small enclosed area became a breeding ground for bacteria. Their curiosity also prompted them to touch the sterilized equipment while the doctors were preoccupied, which promoted infections. In one case, a family member's carelessness led to a chicken's flying onto the operating table and landing on the patient. These circumstances led many Appalachians to fear surgery and doctors in general. They feared they would not awaken from the anesthetic coma, or that complications would cause their dying during the surgery.
Surgery in Appalachia today is not nearly so much a perilous process. Accessibility to doctors, medical supplies, and hospitals is not so limited due to infrastructure development in Appalachia, common ownership of automobiles, and also government aid. Transferring patients to and from medical facilities is not so dire. Surgeons go through extensive medical training and specialized education. Pseudodoctors have largely disappeared. To provide optimal pre- and post-surgical conditions, hygienic practices are strictly enforced for physicians and patients. Increased availability of medical information allows patients to better care for themselves. Awareness of preventative measures also has minimized the need for minor surgeries. In the past 2 centuries, death rates due to surgical malpractice have decreased significantly, and surgery has become safer and more effective. Survival rate significantly surpasses mortality rate. In Appalachia today, surgery is a trusted, normal medical practice that generally increases the quality of life of patients.